Hello, my name is David Wilcox. I'm a clinical education consultant for Biodex and by training an occupational therapist. And today I'm here to show you how to properly apply the unweighing system harness in preparation for body weight support treadmill training on Biodex's unweighing system. This is my colleague Kate, and by training she's a neurocertified physical therapist, and today she has volunteered to be my assistant in the application process. To begin the application process, we have the neoprene wrap. The neoprene wrap wraps around the patient's trunk to a moderate tension. It is held into place by these three straps over here on the side, and it should be placed so the bottom of the wrap is between the ASIS and the greater trochanter. The neoprene wrap is optional. If you decide to use it, it can prevent slippage during body weight support treadmill training. All right, so as you can see right now, the unweighing system harness is on Kate, and it first starts off with the vest portion. The vest portion is attached in the front by two buckles and two fasteners, and it has a blue strap that comes around the front. It's much like a seatbelt. And that's how you can tighten it right there. In the back, we have three adjustments that can also be adjusted back here by either tightening them or loosening. To be able to tell if the vest is on correctly, take a look at this anterior buckle that faces downwards towards the floor or down the person's thigh. This buckle right here should line up with the greater trochanter in this position. I just wanted to spend a couple minutes going over the importance of the buckle that lines up with the greater trochanter on the vest. When you put the vest on, sometimes this buckle can lay either anteriorly or posteriorly to that greater trochanter. If it's too far out in front or anterior, then what you have to do is make adjustments to the vest. And the way that you're going to do that is by tightening the straps in the back and loosening the straps in the front, so the vest makes those adjustments, and that will bring the buckle over that greater trochanter. If the buckle lines up posteriorly to the greater trochanter, then it's the opposite. The vest has to be tightened in the front and has to be loosened in the back until the buckle lines up with the greater trochanter. If one buckle is posterior and the other buckle is anterior, then the vest might just need to be adjusted and turned. Now that we have the vest on, we're going to be coming down to the thigh and applying the thigh straps. And the first thing you want to do is be able to find these two plastic clasps, and then the strap is going to wrap around the thigh, and now we're going to attach the plastic clasps together like so. And as you can see on Kate, it's on the outside part of the leg where the plastic clasps are, and we're still locating this buckle that's dropping down the thigh over the greater trochanter. Yellow buckles, I'm going to attach, make that fairly snug, and remember this is not going to be overly tight. Okay, so once this buckle is on the outer part of the leg, we're going to come back to the back side, and we're going to take the red gluteal fold strap, which originates in the inner part of the thigh, and we're going to bring it diagonally across the buttocks like this and make that nice and tight. Okay, this is going to be important because this is what's going to help prevent slippage from happening during body weight support treadmill training. Okay, now time for the right side, the thigh strap. around the brown. Coming around the back side, gluteal fold. Diagonally across the buttocks. Kate and I are next going to demonstrate how to apply the Unweighing System Harness for the patient that has profound neurological deficits. The best way to be able to do this is in that supine position that we talked about a little earlier. Just remember about some of those clinical presentations that profound neurologic patient present with when you are applying that harness. Okay? So here's Kate again. She's my neurologically involved patient. First thing I'm going to do is I'm going to take the harness, and as you can see right now that I took the thigh braces off. And the reason why I took the thigh braces off is because sometimes they just get a little mixed up, and so it's no problem having them off right now. I'm just working with the harness. I'm going to roll this up. This is the inside of the harness. This is the outside of the harness. We're going to roll this way a little bit. I'm going to place her right here. I'm going to take my patient. All right, Kate, we're going to roll over to your left side. Ready? 1, 2, 3, go. So she's in that position. I'm going to place this right here. I'm just going to roll it a little bit, but I want to make sure that these 3 buckles are going to line up to that spine. Sometimes it's a hard visual, but if you can roughly get where it's going to be, you're in good shape. The next thing you can take a look at is that buckle, that anterior buckle that should be facing down the thigh. Remember earlier we talked about how this should be lining up with a greater trochanter. So if it's up here, that means that the harness is too high. Okay. So I'm going to bring this down a little bit so it lines right up. Okay? So again, we have the patient on her side. We have the 3 buckles on the posterior aspect of the vest lined up with her spine, lumbar and thoracic spine. And then this anterior buckle, in this case on the right side, it's the brown circle buckle lined up with a greater trochanter. Once she's there, all right, Kate, we're going to roll you back over. So come on over. Just be aware of how you're talking to the patient, making sure that they're comfortable, and make sure that you're cueing them appropriately and giving them that proper or appropriate therapeutic assistance. Okay? All right, Kate, I'm going to have you roll over to the right side, right here. Good. Okay, once she's rolled, what I'm going to do is straighten the vest out. And again, this is the inside of the vest. Okay, Kate, come on back around this way. Excellent. The next step, I'm going to fasten the Unweighing System Harness by taking those 2 fasteners in the front to the 2 buckles. You want it nice and taut, not overly tight so it cuts off circulation or is too uncomfortable. Next, I have the shoulder straps. I might want to bring this up this way just to kind of get an idea of where the shoulders are. Okay, let's roll towards this way. Let's take a look. So as you can see, those 3 buckles on the posterior aspect of the harness are lined up with her thoracic and lumbar spine, and this brown coated buckle is lined up with a greater trochanter on that right side. A couple things to remember with this neurological patient. If they've had a stroke and if they're hemiplegic on either side, just be careful of how you roll the patient. Use your sound clinical judgment. Now that we have the vest on, it's time to put on the leg straps. In this case, what we're going to do is we're going to take the inner part of the thigh strap and we're going to put this on first underneath Kate's thigh, And we're going to take the plastic clasp right here. We're going to attach that from a positional standpoint, 3/4 of the way up the thigh. You know, semi-snug like we talked about earlier. Okay. Next what I'm going to do is I'm going to attach this strap, the one that lines up with the greater trochanter. And I'm not going to tighten it too much right now, just for positional purposes, so the thigh strap is on. I'm going to have my patient, Kate, roll to this side over here. All right, so now that Kate's in sideline, you're going to see that the gluteal fold strap is going to initiate from the leg right in the inside part of the thigh. You're going to bring this up, and it's going to, the red strap, you want it to hug the butt cheek, because that's what's going to give the support. And then you're going to connect blue to blue, make that nice and tight. Come on back around, Kate. Okay, same thing on the other side. Same thing, we're going to lift up the thigh. We're going to put the thigh strap around her thigh, the upper 2/3 portion like we talked about. Clasp the plastic clasps. Yellow buckle. Yellow to yellow. Okay. Not too tight right here. Okay, because she's going to be in an extended position. All right, Kate, you're going to roll to this side. All right. And again, here is the red gluteal fold strap. You'll see where it's going to originate from the inner part of that thigh. Okay. I'm going to bring it up, making sure that I hug the butt cheek. Green to green. Nice and tight. You want to make sure that it's coming up through, and it's a little bit of a diagonal movement with the gluteal fold straps. This is what's going, like I said earlier, this is what's going to give it support. Don't have it so the red gluteal fold straps are on the lateral side of the buttocks, because you're going to find that it's going to slide a lot. There are certain patient scenarios where the thigh straps of the Unweighing System harness might not be appropriate for body weight support treadmill training. Some examples might be the patient might be too thin and might not have enough gluteus maximus or butt muscles, or their thighs might be too thin, and as a result the thigh straps are going to be a little bit too big for them, and the straps aren't going to do what they're supposed to do as far as unweighing that person. Another scenario would be for someone that is significantly neurologically involved, and as a result of that, when they're up in the standing position with the harness on, that they're just sliding in and around that harness even with the thigh straps on. So in that case, what you can do is you can take off the thigh straps and you can replace it with what's called the inguinal strap. And the inguinal strap is going to come through the groin area and take place of the thigh straps, and this is going to offer a little bit more support for body weight support treadmill training. And in a minute, we're going to see Kate have this on in the supine position. There are a couple disadvantages of the inguinal strap. As you can see, that there's the rubber inside right here could potentially rub against the inner part of the medial part of the person's thigh. The weight of their body could be coming down on the inguinal strap, so that can create discomfort, especially with men. It's going to be up to you, using your own clinical judgment and clinical reasoning, to make that determination whether to use the thigh straps or the inguinal strap. Okay. These are not color-coded, but they're pretty symmetrical. This is the inside. The inside has some friction, is a little rough. I'm going to come up through here. I'm going to find my right, I'm going to attach it to the anterior buckle that lines up with the greater trochanter. Here's the posterior. I'm going to attach the blue. All right, Kate, want to roll down to the other side. Again, you find the posterior buckle, attaches here. Anterior buckle attaches to the circle that has the yellow on it. And to look at it from the front, this is what it's going to look like. So what this is going to do, this is going to provide more support for the patient in body weight support treadmill training, and it'll prevent slippage from happening when the patient is being suspended by the unweighing system. It's also recommended that you have an assistant. It's always good to have an assistant to help with the rolling process, especially if that patient requires total assistance.
If you're working with a patient or client who is a little bit higher level, may be able to support themselves in a seated position a little bit better and may not need to roll on the mat to don the harness, you may be able to do it from a sitting position. If they're able to stand for longer periods of time with only minimal assistance, you may want to consider donning the harness in a standing position, which we'll go over in the third demonstration. So right now I'll just show you how I would don this harness from a sitting position for someone who could stand again with for short periods of time with a minimal assistance level to possibly moderate assistance. So Dave is seating in his wheelchair here. And again, I'm going to start with just the body part of the harness, the trunk part of the harness, with the leg portion removed, just to make it easier so these straps don't get tangled as we're trying to put it on. So I will start by asking Dave to lean forward a little bit. And again, if I had an assistant here, I would have them guarding Dave, but I know that Dave isn't going to fall, so he's okay for now. All right, and I'm going to line the bottom edge of the trunk portion here up with right around where Dave's posterior iliac crest is here, or the upper part of his hips. Okay, and I can also see, from back here that the buckles are in line with his spine. You're going to have to trust me on that. And I'll clear the buckles and straps and have Dave sit back again. Stick that on. Okay, and I'm going to find these two blue straps again. I usually start with the upper one first. Fasten around.
As you can see right now, the neoprene wrap is not on my waist. And again, that's a clinical decision on your part or on the therapist's part.
Now we're ready to apply the thigh portion, the thigh straps. So we're going to make sure our colors line up. So I've got blue sticker in the back here, brown sticker, and brown sticker at the greater trochanter on the right hip here. So in order to set up your alignment properly, find the red seam where the red gluteal fold strap attaches. We're going to put that near the medial thigh on the right. And then I'm going to let that be able to hang. And I'm going to find my plastic clasps here, which you'll be able to see probably better on the other side when we get over there, to attach on the lateral aspect of the thigh. So now we're going to bring the inner thigh portion of the strap up towards the greater trochanter, the brown sticker, match them up and attach. And just make sure here that we don't pull it too tight. We want it snug, but not too tight. Since the person is in a flexed position, the angle is going to be a little bit tighter when they stand up. So we don't want to pull it too tight at first. When preparing to attach the red gluteal strap, you'll want probably the side of the hip to be free so that you can have the patient weight shift all the way over, clearing just enough so that you can attach blue to blue. Okay, and you're setting up on the opposite side again. Make sure that the red strap seam shows for the medial thigh. Here's your plastic clasp. Yellow, yellow. Keeping loose here for when we stand. And again, coming down for the red strap underneath. Green to green. And also just to demonstrate, even though we're talking about someone who may be at a little lower of a neurological level, I am going to have Dave stand up quick so he can show, you know, now this strap is now tight, whereas in sitting we saw that there was a little bit of laxity there, but we can see a lot of laxity here in the gluteal strap. So if you turn just a little bit more, we can see a lot of laxity here, so we're going to need to tighten that up. You can tell before you prepare to actually use the unweighing system. You want to make sure these straps are in the optimal level of tightness. Finally, we come to the third patient scenario. This is the person with minimal neurological involvement who is likely to be able to stand with minimal assistance to supervision for at least 4 minutes. I personally find it easier to don the harness when the person is in standing, just because there's less transition involved and you're able to set up the harness and make the appropriate adjustments, and everything is all good to go by the time you're ready to hook up to the unweighing system. So when someone's at this level, it becomes a little bit less time consuming. Again, I would, and if I had an assistant, I would have someone standing by my patient also to make sure in case there's any loss of balance. So I start by, again, holding the harness kind of like you would a jacket that you're going to put on to go outside on a cold day. We'll start by threading one arm through and then the other. I can see here as the harness hangs, it's likely to hang down a little bit too low because these straps are meant to be not flush with the shoulder as the person is standing. So I may have to pull it up a little bit, or I would ask my assistant to help hold the harness up at the proper height. For now. Okay, so again, starting with the blue straps to secure the harness around the trunk. Now we're ready to move in and apply the leg straps. So again, we'll find the red gluteal strap, and as you bring the thigh strap around, we're going to bring that red seam in towards the medial thigh, keeping track of the plastic clasp as it comes around the front. Loop it through, clasp, and tighten. Not too tight. And bringing the front. And to the other side, down to the medial aspect of the thigh with the red. Okay, and the red is already attached. Bringing the anterior strap yellow to yellow. And now you can see the nice diagonal orientation of the red straps there, again providing the optimal upward support to keep the harness from sliding up.
One last note before we end this video. Just be aware of any external device on the patient, such as a colostomy bag or a catheter, a Foley catheter or a suprapubic catheter. What can help in training is the neoprene wrap. If you apply the wrap, that can help protect some of the rubbing and some of the pull that can happen from bodyweight support treadmill training. This concludes today's video. I hope this helps in the clinical decision-making process in the safe and effective application of Biodex's Unweighing System harness in preparation for bodyweight support training. Thank you.